what I've heard. A lot of people have been crying to me about this issue. We've had some people have heard that their loved ones have died. They didn't know it. It's sad. So I think that this gives them a glimmer of hope.
Newly released data on COVID-19 cases is showing the impacts on nursing homes across the state. The release of that data is a first in 6 weeks.
Well, initially the state named nursing homes with clusters of the virus, but stopped publicly naming those locations. The data shows the facility with the highest death toll in the state is a nursing home in St. Landry Parish. J. Michael Morrow Memorial Nursing Home is in Arnaville. It reported 68 resident cases, 34 deaths, and 29 staff cases. Across the state, nursing home patients account for at least 35% of the fatalities from COVID-19. Three's on the Street tonight. Our Kendria LaFleur joining us live from the Department of Health office in Lafayette with new information that's giving clarity to some. And also, Kendria, health officials are also working on prevention measures at nursing homes, right?
Yeah, advocate groups have been pushing for the release of this data. Now they're welcoming the Department of Health's decision.
We've been pushing for honesty and transparency from the beginning.
Brian Lee is with the nonprofit Families for Better Care. He's been working to improve living conditions for nursing homes across the nation. He says the data is a step in the right direction.
The families, they're the ones who have loved ones there, who committed their loved ones to these facilities and entrusted them to care for them when they needed help. And so to not be honest with them is opposite of compassionate. So now that they're moving towards transparency, it's the right thing, it's the moral thing to do, and people deserve this information.
What's led us to this point is the role of asymptomatic spread of the infection. Now we know that there's a great proportion of individuals who show no symptoms who can spread infection, and so you can imagine in a setting like a nursing home that makes it very difficult to control spread.
Dr. Tina Stefanski says more testing will be done in facilities on a weekly basis, even testing those who have no symptoms or had prior negative results.
The recommendation now is that you test or screen asymptomatic individuals. So now we're really working with facilities to test everyone in their nursing home. So when you see a nursing home with a lot of cases, the good chance is that many of those individuals are asymptomatic.
According to LDH, there has been an increase in cases in Acadiana, while some facilities are reporting 0 cases. Stefanski says with more testing, that can change.
You're going to probably continue to see numbers increase.
Meanwhile, Lee says an increase of testing and data being released will bring some change to those who are most vulnerable to the virus.
It helps them to make decisions about what they should do next. And plus it helps to improve communication between the nursing home and the family members where these cluster outbreaks are happening.
And again, the Department of Health is pushing for everyone inside of a nursing home facility to get tested whether they're showing symptoms or not. Three's on the Street, live in Lafayette. Kendria LaFleur, KATC TV3.
Well, some good news coming from the newly released statistics. As of today, 19 Acadiana nursing homes are reporting no coronavirus cases among their patients or their staff. That includes all of the nursing homes in Jeff Davis and Vermilion parishes. Some nursing homes in the region are still have data pending.